Hey, we were just talking, when I was in college, I was on the speech team and wrote a speech about cataracts. My dad had cataract surgery. Never thought about it for animals, but Dr. Jerome Williams is here, along with Dr. Susan Nelms, to tell us all about cataract surgery for our pets. Hey, guys.
Most of our aging pets, hello, will eventually get cataracts if they live long enough.
Really? So it is just a natural thing that happens a lot like humans?
It is, and one of the big differences, though, for dogs is that many of the cataracts we see are genetic. It's a genetic tendency, and so often they're younger animals. And
so certain breeds are more susceptible than others.
Are more prone.
For example?
Tina Rose is, we got her at the Humane Society, so she's long-haired Chihuahua mix, and she's had her cataracts at a very young age, and we've had her for about 6 years. She's about 8 or 9 years old, and she had cataract surgery this spring.
How'd it go?
And it went really well.
It went really well? All right, you were telling me, and we've got some pictures to go along with this, but you were telling us, telling me in the break that putting a person to sleep for a surgery is a lot different than putting an animal to sleep. What is it?
Well, most people who have cataract surgery don't really need anything more than some sedation, light sedation, and they can have a very easy outpatient procedure. For dogs, we would never be able to have them still enough to perform the procedure, have them positioned under an operating microscope. So they have to be under general anesthesia.
Okay, so what are we looking at here?
So this is our surgery suite at our practice, and this is Tina Rose getting positioned for her surgery under the operating microscope. And that was Leslie, our veterinary technician, an anesthesia technician, and this is just right before surgery.
So while that may be different, is it similar to?
Yes, it is similar.
Okay.
The instrumentation, the procedure, removing the lens and placing an artificial lens implant, all.
That's quite a procedure.
It's a very involved procedure. I think people don't really understand.
Okay, so afterwards,
And
what's going on?
Just waking up, and owners always say, "Can they see yet?" Well, she's so groggy, we don't know yet.
Yeah.
That's her one day after recovering in ICU.
So how are you able to tell that it's better, except for the look of the eye?
Right, that's right. It's very subjective that we have to do an eye exam and then watch their behaviors and have their owners kind of report back.
So you can see them behaving a little bit differently?
Yeah, as soon as they wake up. They're usually so excited and looking
I see
around. It's very rewarding.
Is it very expensive if someone has to have that done?
It is an expensive surgery.
Okay,
so.
that's good to know.
Yes.
If you were thinking about it. So, and I know some people have insurance on their pets,
Yes.
but most people
do
don't
have insurance.
Yeah.
A lot of people don't have insurance.
So how do you recommend when you have a dog that comes in? Do you notice it?
Yes, you notice that white film-looking thing if you look back in the eye, and you can also use light to see if there's a response to light, and then we refer to people like ophthalmologists like Dr. Nelms early, and they can do an evaluation to determine whether there's sight beyond or beneath that the film that
So
we
I guess
see.
if they're not responding, then you know there's something going on with the vision.
Right, and we always want to weigh out the benefits and the risks, and we usually are very conservative about recommending surgery until we're to a point where vision is significantly impaired before we go to surgery on a dog.
You use certain instrumentation to examine the back of the eye before the surgery.
That's right. So they would have a very complete eye exam and then some other diagnostic tests to make sure that their eye is healthy.
All right. Well, Dr. Nelms at exit 6 and Bessemer, the exit there at
Helena
Greenwood.
Bessemer exit.
Okay.
That's right.
And we know Dr. Williams, Red Mountain Animal Clinic.
Always good to be here.
It's always good to see you.
Thank you for having me.
Okay. We'll take a break. We'll be back checking in.